Hello friend, welcome back to our channel Radiology Technologist. Today's are most welcome to our channels. So without wasting time, we are cover the second part of the ISRO question paper. Question number 23, cell are the most sensitive in phase of the cell division is correct answer for the mitosis. Mitosis are the most radio sensitive and S phase are mostly most radio desensitive, that's mean most sensitive mitosis or less sensitive uh, S phase or Z phase. Okay. So question number 24, Bowtas filter is filter is used for minimize. Question number 24 is correct answer with the D. Okay. First option, photo starvation, beam hardening effect under sampling artifact. Okay. So correct answer with the D. 24. 25. Ultrasound frequently commonly are used to diagnosis 1 to 20 kilohertz. Option number 2, 20 to 40 kilohertz. C, 1 to 20 millihertz. D, 20 to 40 millihertz. So correct answer with the C. And 20 to 40 is sound, hearing sound. Okay. So correct answer with the C. Question number 26. The weakest part of the circuit protects circuit from the damage due to overload is fuse. A. Transient exposure of mammography when the compared to conventional radiography are is transistor. So is shorter. Okay. Cesium 137 iodine is used to 30 years. Question number 29. The transthoracic projection of proximal humerus is also known as the position of the transthoracic projection of proximal humerus or Lorentz. Okay. Lorentz or Lorentz position is transthoracic projection is proximal humerus is also known as Lorentz. Okay. So a correct answer will be the D. Okay. Piezoelectric material used in medical ultrasound is lead zirconate. A. 30 is correct answer to the A. 31 ileum peaks are part of the pelvis. X-ray are produced to change the direction of high electron beam and during the nuclear and transist the high energy of the. So a correct answer will be the during nuclear expansion transist from the higher energy state to lower energy state. So its correct answer will be the A. 32. 38. 33. In digital radiography testing, spatial resolution are detected to determine the dimension of small features and can be resolved to modulation of 20 space of geometric magnification. Dimension is smallest feature that can resolve it as modulation 20% with the geometric magnifications. So it will be asked about the spatial resolution. So spatial resolution that can resolve in modulation 20% of the geometric magnification. So with okay, so correct answer will be the A. Transducer 34, question number 34. The transducer which more that one element is known as array. 34 question number is question number 34 is correct answer with the B. Okay. Helix view is done for the metacarpals. Wrist, patella and toe. So is generally taken for the toes and metacarpal. Sorry, is generally taken for the so the hallux view is done for taken for metatarsal or toes. So it there is no option given metatarsal. So its correct answer will be the D, toes. Okay. The procedure 36, question number 36. The procedure is for nasolacrimal duct is opacified the injection contrast media. So everyone know is normal question or a simple question is decrocystography. So is injected contrast through the nasolacrimal duct and ossified the and see the orbital, cavital or orbital any pathology seen in decrocystography, like indication of the uh, inflammation of the eyes, and there are the redness of eye, there are the tears in the eye. They are indication of the procedure decrocystography. So its correct answer will be the D. C. Decrocystography. Appendix may be found in most above in this pericolic, pelvic, retrocolic, subcalyx. So its correct answer will be the retrocecal. Okay, the appendix may be found in most often in the retrocecal. So 38, the unit of activity of radiation source radiation. So there are two unit radiation any. So unit activities are asked in the SI unit or conventional unit. Both are two units are any elements or any uses in radiations like exposure, radiation absorbed dose, radiation RAM. They are most are the two units, but you are asking the unit of activities of radiation source in radioisotopes. So is becquerel gray Rontgen. See what is the RAM is a unit of the RAM. Rontgen are unit of the exposure. Becquerel are unit of activity, and gray are the radiation absorbed dose rad. So is unit of gray is rad, Rontgen are exposure, CO as RAM. So is only remaining one option is one becquerel. Okay. Bone projection behind the ears, mastoid process, olecranon process, stellar process, or cuneiform. So everyone know olecranon process are in the upper limb, mastoid process are the ear, and stellar process are the ulnar. So only one process olecranon process are the ossified in the ulnar or radius nearby, but stellar process are the behind the ear. So its correct answer will be the B. The left lung has two lobes, the right lungs have three lobes. Okay. For a good AP projection of the scapula, patient arm should be the scapula. So a hand will be the internal rotated, external rotated, adducted, abduction. So it will be the abducted. Okay. Imaging 30, question number 42. The imaging modality of choice, the patient is susceptibility of the herniations. Hernia are taken for the plain radiographer, MRI, CT scan, myelography, but are the most sensitive or choice of the patient suspected disc herniations. You can use to MRI scan preferably. Okay, because disc are the bulge and is fibrous tissue are made up of the disc, but there are herniations, so you can performly MRI scan, because plain radiographer they are not detected the disc herniation. CT scan are the used to mainly bone anatomy. Myelography are the used to spinal cord. Only one option remaining have MRI scan. Okay. Photo sterilization is overcome to the KUP increase the tube current, decrease the FOU, decrease the slice thickness. In photo sterilization, photo are the use of electron sterilization that are increase the KUP. Okay. B. AC to DC converted, they are the rectification. A. Fluctuation, they are fluctuating the voltages are the based on the principle. Thermonic emission, they are used in the cathode terminals. Transformation are the high voltage to low voltage to high voltage. AC to DC that are used to rectification. Okay. Question number 44, correct answer without A, rectifications. Addition effect is a photoelectric effect, chemical effect, electricity, thermonic emission. So it's are the answer of addition effect is the photoelectric effect. Okay, thermonic emission not photoelectric effect. Okay. The breast MRI patient must be placed in prone position. A option 46. Correct answer will be the A. The trachea bifurcation are the D4 and T4 is also called T4. Dorsal spine or thoracic spine. D4, T4. Okay. The arteries that carry blood from the left ventricle to heart, the organ of the body is the aorta. Okay. And they are taken from O2, and there most of the question asked from the where is the oxygen blood and where is the deoxygenated are carry the vein are pulmonary vein are carry the O2 and pulmonary artery are the carry the CO2. Okay. The function of collimator attached to X-ray tube: increase exposure, amplify exposure, restrict the primary beam, decrease the processing time. The what is are asked the collimator attachment of X-ray tube. The increase exposure, they are to decrease the unwanted exposure, secondary exposures. They are not used to exposure increase. They are not used function of collimator. Amplified exposure, okay, restricted primary beam, decreasing processing time. Processing time are not vary on the collimations. Restricted primary beam are remaining two option only, B and C. Increase exposure, not decrease exposure. They are used. So they are restrict primary beam. You can amplified exposure. Amplified exposure, they are used to according to arrange the radiation, the amplified exposure. Okay. The advantage of oil based contrast hysterosalpinography, HSG. So ask about the HSG. What is the use advantage of the oil based contrast? There are no risk of embolization, no risk of peritoneal glomerular reaction, or increase the post test fertilization reaction, less pain. So there are correct answer with the peritoneal granulomatous. So reactions, no risk of peritoneal granulomatous reaction. So correct answer with the B, 50. The gold standard test for myocardial viability. There you can go to ventricography, echocardiography, thallium test, FDG test. So they are going to is gold standard for myocardial viability, FDG, fluorodeoxygenated PET scan. So correct answer will be the D. Cardiac gating is used to minimum motion beam hardening effect photos. So cardiac gating is beam hardening effect. The normal phalanges of in the hand 14. You know which among the following not found in mediastinum: trachea, thymus, esophagus, thyroid gland. So is not found in trachea are founded, esophagus are founded, thyroid gland are found, thymus gland are not founded. Sorry, thyroid gland are not founded in the mediastinum because thymus gland are founded, trachea are founded. Thymus gland are above the just nearby liver, they are mediastinum. Esophagus are the mediastinum. Thyroid gland are the above the chest level. Okay. Smallest wrist bone is a lunate pisiform hemate scaphoid. The smallest wrist bone are the pisiform. Okay. Post secretory are that secretory film xylography taken after the duration of the 5 to 10 minutes, but the post secretory film xylography taken for the 10 minutes. Okay. 10 to 15 minutes, but are the option are given to 15 or 10 minutes, so you can go to 15 minutes. Okay. Central loop are the third node. Central loop node are third nodes. Okay. Skull consists of 22 bones. Primary function of the gastroesophageal sphincter. What is the function of the esophageal sphincters? Allows reflex from the stomach into the esophagus, maintain the food esophagus, prevent the reflex stomach, and enhances MLS. So allows acid reflex from the stomach into esophagus. No, the sphincter not maintain the food in esophagus for digestion, prevent reflux of stomach consist, enhance the action of amylase. So is are the B. Maintain the food esophagus for the digestion. TLD based on the phenomena of thermoluminescence. ERB. The responsibility implementing ERB guideline instruction into the chief technologist, radiologist, RSO. D. DICOM, digital imaging communicating medicine. So D 6 to 2. The projection of central rays incident, the anterior aspect of the passes along the transverse and medial sagittal plane are the emerges from the posterior aspect. So okay, the anterior to aspect is the posterior anterior. So projection of central rays incident to anterior aspect. So anterior aspect passes along the transverse plane. So you can go to is a AP projection. Okay, anterior to posterior. A. So here as from posterior aspect. So is a PA projection B. Okay. Dark room window should be provided for a proper. Window should be avoided. Window should be given with a less late relation shading. So its correct answer is the window should be avoided in dark room. Okay. Each square in image matrix is also known as pixel and 3D are voxel. Father of medical ultrasound is they are most confusing question, but there are given to John Fields, Georg George Ludwig, Ralph Joseph Holmes, Joseph Steinmetz, but are the option of the B. Artifact occurring in the when radiation remain the trapped in the phosphor plate. So is a ghost image. C. ECG recording. Electrical activity of the heart. X-ray discovered by Ronjan. Which among the following the not true of the developers? Metal and hydroquinone act as a reducing agent. Potassium bromide act as a antifogging agent. Sodium sulfate are act as a preservative. Developer sodium is a acidic. Okay, so is a not true asked. Potassium bromide act as a antifogging agent is B. Which of the following are the important exposure parameters that are used to radiography testing for human parts? All of the above. Imaging technique or develop measure the elastic properties of muscular tissue. Palpography. Sorry. Circuits fruits are the Cyrus fruits. So lark stimulating secretion saliva inhibition does of the activation of the saliva inhibition of the. So its correct answer will the A. Dental formula for 2123 B. T2 bar the tentatives. Skyline with the patella. RFA are the elderly treatment patient are the cannot tolerate generation as the. So it will be the correct answer with treatment of multiple lesion, small lesion, early hepatocellular carcinoma, RFA contraindication. So elder frauds patient for the cannot. A. For pelvic ultrasound urinary bladder should be full capacity. Fixing agent are used to sodium thiosulfate. Primary advantage of multiple spiral city. Increase patient dose, high cost imaging a large volume, increase the acquisition time. C. So okay guys, thank you so much for still watching. Thank you and keep study and grow and achieve your aim. Best of luck guys.